Okay, so from last lecture, you remember the last three structures, right, belong to the respiratory zone where gas exchange takes place, right? Above that, only for the passage of gas, right? So these are those three structures: respiratory bronchial, alveolar duct, and then alveoli. And most of the exchange takes place through the alveolar wall. Small amount of gas exchange occurs in the respiratory bronchial and alveolar duct, but mostly exchange occurs through the wall of the alveoli. And if you see the wall of the alveoli, you will see many tiny holes. Those are called the alveolar pores. Okay? And you remember I said that you have in each lung 150 million alveoli. And the blood supply of the lung is so, beautifully done. Each alveolus receives a capillary on its surface. So this is the capillary on the surface of the alveolus. Okay, so this is alveolus, and this is capillary on the surface of the alveolus. Okay, so that makes the gas exchange easy, right? Because blood capillary is just on it, every alveolus. So exchange becomes easy. And the alveolar wall is very thin. Capillary wall, you already know, is really very thin, right? So thin wall. Through the thin walls, the gas exchange takes place. In the lung, you already remember that blood goes to the lung to get what? Oxygen, right? So from the alveolus, blood will go, oxygen will go to the blood. Make sense? And carbon dioxide always goes in opposite direction. You remember I said that is the rule. So if you know one, you know the other. So carbon dioxide moves from the capillary blood into the alveolus. Okay, so carbon dioxide gets in, oxygen gets out from the alveolus to the blood. Is it clear? So blood gets oxygen and gives carbon dioxide to the lung, to the alveoli of the lung. We expel the carbon dioxide out, right? And that oxygenated blood gives oxygen to the body. Okay, so that is the external respiration. We have talked about that in last class. So now, you see, the gas must pass through these two walls, thin walls, but two walls. One is the wall of the alveolus, another is the wall of the capillary, right? Those are attached. So, the black one is the wall of the alveolus, the red one is the wall of the capillary. So gas must pass through those two walls. So if I draw here, this is the wall of the alveolus, and this is the wall of the capillary. Okay? And both alveolar and capillary walls have two layers in it. Okay? One is called the basement membrane. So this is the, you see here, so both have two layers.
The red is the capillary?
Red is the capillary, yes. So this is the basement membrane of alveolar wall, and this is the basement membrane of capillary wall. So both have basement membranes, and they are attached to each other like this. Okay? And then that's why we say fused basement membrane, this part. Fused basement membrane. Okay? And then in the alveolar side, you have alveolar epithelium, and capillary side, you have capillary endothelium. So this is capillary endothelium, and this is the alveolar see, both have basement membranes, and we can say this is, since they are together, we can say fused basement membrane. Fused basement membrane. Two basement membranes, one from capillary wall, another from alveolar wall. Okay, they are attached to each other. So, if we think these two as a single layer, fused basement membrane, so we have three layers here. From the capillary side, if we go from this side to that side, capillary endothelium, fused basement membrane, and alveolar epithelium. So those are the three layers. That is called the respiratory membrane. Alveolar wall and capillary wall together form the respiratory membrane. And gas passes through those two layers, three layers. So that is the respiratory membrane. Here you see how beautifully every alveolus gets capillary on its surface. So you have beautifully the capillary beds are resting on the alveoli. Okay, so that's how the exchange occurs. Now, if you see the cells in the wall of the alveolus, three types of cells are present in the wall of the alveolus. If you see the alveolar epithelium, okay, this one, three types of cells. The most part is formed by simple squamous, like this. You remember simple squamous? You must remember, right?
Yes.
Squamous is what kind of cells? Flat or tall?
Flat.
Flat, very good. So you have flat cells, nucleus. Make sense? So a single layer of flat cells. Simple means single layer, right? Stratified means multiple layer. So simple, squamous, a single layer of squamous cells, flat cells. That means very thin. This is the alveolus. And there are two other types of cells that are also present. Those are few, mainly by simple squamous, but you also have macrophages, phagocytic cells, you know that, and surfactant secreting cells. These cells are really very important. Surfactant secreting cells. So three types of cells. Mainly the wall is formed by simple squamous. So this is the main one. Simple squamous epithelium, and then macrophages, phagocytic cells. They engulf the dust or other antigens, and this is very important. Surfactant secreting cells. Okay, these are also called type 2 cells. Type 2 surfactant secreting cells. Okay, remember that. Simple squamous are the main ones and called type 1. This is type 1. Okay. So those are three types of cells present in the wall of the alveolus.
Is the surfactant secreting cell type 3?
We don't say type 3.
Oh,
Yeah, macrophages, we say macrophages. Okay. Now, you see, you have about 300 million alveoli, right? In two lungs together, and each alveolus has macrophages. That means what? You are inhaling air all the time, right? Taking the air from outside. Lot of, bacteria, microorganisms are getting in, right? Dust particles are getting in, right? So those macrophages are sitting there and they will clean up. Make sense? So those dust are antigens, microorganisms. So that's why you have macrophages, very important. should be there. Otherwise, you will get infected easily, your lung. Thin simple squamous helps in what? Gas exchange, right? Easily gas will get in and out. And surfactant secreting cells. These cells I said very important. Why? They secrete a chemical that is called surfactant. It is a fluid called surfactant. And that surfactant lines the inner surface of the alveolus like this, that fluid, okay? Lines the inner surface of the alveolus.
So what does it do? I'm sorry.
And prevents the lung alveoli from collapse. So keep the alveoli open. Just know that lines the inner surface of the alveoli, right? And help to keep the alveoli what? Open. If surfactant is absent, alveoli will collapse. Okay? Will not open. So very important, right? When you inhale, the alveoli, right, expand. So that will not happen. It will remain collapsed if surfactant is not there. So very important fluid secreted by type 2 cells to keep the alveoli open, prevents collapse of the alveoli. Now, there is a disease that happens in infants that is called infant respiratory distress syndrome, IRDS. Infant respiratory distress syndrome. What happens in infants in this clinical condition? Surfactant secreting cells are absent in the alveoli. So what happens? Surfactant is not there, right? So alveoli will collapse and the infant will not be able to inhale the air. Make sense? So this is a serious clinical condition that happens. It is a genetic disorder usually. But also it happens if the birth is premature birth. If it is genetic disorder, then it becomes very difficult to fix, right? The person, the infant doesn't have that gene that will produce those type of cells. So that is a problem. But if it is due to premature birth, then if you take care of that infant, right, slowly those cells will appear. Okay? Because when the lung will get mature, those cells will be formed. If you see the anatomy of a lung has an apex, which is the top pointed part. This part is called the apex. Bottom part is called the base. And the base rests on the diaphragm. Okay? And the difference between right and left lung, they are not exactly same. Okay? Right lung, if you see right lung, it is shorter this way and broader. That means short and broad. Let me write it down here. Right lung. And this is left lung. Okay? If you see the differences, right lung is what?
Short and broad.
Short and broad. Shorter and broader. Left lung is long and narrow. Opposite, right? So right lung is this way short and broad. Left lung is this way narrow lung. Why is that? Your liver is mostly in this side, right? Right side. So when liver and lung grow in very early stage of life, liver occupies some space here. Make sense? So pushes the bottom of the right lung because liver needs space, right? So it will push the lung up. Okay? So right lung gets shorter. Okay. Now right lung, if you see, has two fissures or cut slices. Horizontal fissure and oblique fissure. Horizontal is also called transverse, you can say that. So two fissures or cuts. So two fissures, deep groove or cut. So now you tell me, if right lung has two fissures, how many pieces? 3 lobes. Make sense? So 2 fissures, 3 what? Lobes. Superior lobe, middle lobe, inferior lobe. Makes sense, right? Superior lobe, middle lobe, inferior lobe. Left lung has only one fissure, oblique, no transverse or no horizontal. So only left lung has how many fissure? 1 oblique fissure. So how many lobes? 2, superior and inferior. Make sense? If you cut only once, then it will get 2 pieces, right? Superior, inferior. So 1 fissure, 2 lobes. Another thing, in left lung, you'll see this part has a notch. You remember in the bone you have seen the notch. Notch is U-shaped area I mentioned before. U-shaped like this, okay? That is a notch. So in left lung, you have a notch like this. That is called the cardiac notch because of heart. Heart is mostly in the left side, you know that. So to give some room to the heart, it gets a depression here. That is called what? Cardiac, heart, cardiac notch, U-shaped area for the heart. Heart pushes it. Your heart is here. Your heart is here. But no cardiac notch in the right side. So no cardiac notch. Yes, there is a cardiac notch in the left lung. Make sense? So those are few differences between right and left lung, and you know why. Why right lung is shorter? Because of
Liver.
the liver. Very good. Why left lung has a depression notch? Heart. Make sense? So just know that. Here
Do
you
they-
see, yeah,
Do they both do the same amount of work, even though,
the volume.
yeah.
Volume is slightly different, not exactly the same, because of shape is different, size is different. So this is the diaphragm. This part is called the base, attached to the diaphragm, and this is the apex, right? You see 2 fissures in right side, 3 lobes, only 1 oblique fissure, so 2 lobes, superior and inferior. This is cardiac notch. Okay. Now, blood supply of the lung. You all know that pulmonary circulation is the circulation between your heart and what? Lungs. Pulmonary, right? So we know that lungs receive blood from the heart, right? What kind of blood? Deoxygenated. Make sense? And blood becomes what? Oxygenated by gas exchange, right? And oxygenated blood gets back into the heart, right? So that is one type of blood lung is getting all the time, right? Deoxygenated blood from the heart. Make sense? That is a part of which circulation? Pulmonary circulation. Is it clear? You already know that. Lung receives deoxygenated blood from the heart, that is pulmonary circulation. So that is one circulation. But lung tissue needs what?
Blood.
Also needs
Oxygen or carbon dioxide?
oxygen.
Oxygen. All tissues of your body needs oxygen, right? For metabolism. So lung tissue receives oxygen not from pulmonary circulation, because pulmonary circulation taking deoxygenated blood to the lung, right? So lung tissue needs oxygen, and that oxygen comes from systemic circulation between the heart and whole body. Whole body includes the lungs, right? Tissue. So you see, your lung has two types of circulation, pulmonary and systemic, right? Pulmonary is for to get the oxygen from the lung, right? And systemic to give oxygen to the lung tissue. Is that clear? Okay. So lung receives blood from both pulmonary circulation and systemic circulation. In pulmonary, receives deoxygenated blood enters into the lung. In systemic circulation, oxygenated blood enters into the lung. And this one is to give oxygen to the tissue of the lung. And now we know in pulmonary circulation, pulmonary trunk, then pulmonary arteries take the deoxygenated blood to the lung. So pulmonary arteries, we know that deoxygenated blood to the lung. In systemic circulation, bronchial, these are called bronchial arteries, take oxygen rich blood to the lung tissue, to give oxygen to the lung tissue for metabolism. Okay? So bronchial arteries take the oxygenated blood to the lung, and bronchial veins bring the deoxygenated blood back. So that is the blood supply of your lung. Okay? And we know that systemic is high pressure system and pulmonary is low pressure. Pleura, we have talked about that in last class, that it is a double layered serous membrane around the lung. Like your heart, around your lung, you have, this is the lung, you have double layered serous membrane. One is attached to the lung surface, that is one, and another one is not directly attached, and this is the parietal pleura, and this is the visceral pleura. And you have a gap in between, that is called the pleural cavity. Okay? Pleuritis or pleurisy, I have talked about that in last class, right? Inflammation of that pleura is called pleuritis or pleurisy. Okay. Did I talk about that in last class?
Yes.
Pleuritis. You are in biology, human health and disease, so I'm just thinking if I talked about in that.
No, we
class.
haven't gone to the respiratory system
That's
yet.
good. Okay, good. Okay, so mechanisms of breathing.
What is PP and VP stand for?
Parietal pleura and visceral pleura. Parietal layer, you know, pericardium, remember, around the heart has two layers, right? Outer parietal, inner visceral, same way. This is parietal pleura and visceral pleura. Now, respiration has two phases, inspiration and what? Expiration. Inspiration is also called what? Inhalation. And expiration is also called exhalation, right? So we inhale air and expel air. We inhale air to get the oxygen, expel air to expel the carbon dioxide out from the body. Now, I mentioned in last class, which one is active? Which one is passive?
Inspiration.
Inspiration is active. So your diaphragm and intercostal muscles. Remember that? When diaphragm contracts, what happens? This is the lung. This is the diaphragm here. When diaphragm contracts, it goes down. Remember, that is important. When diaphragm contracts, it moves down. So that pulls the bottom of the lung down, right? So the lung expands in this way, vertically, right? You must remember, not just a couple of days ago. When the intercostal muscles contract, ribs move which way? Forward, slightly upward like this, okay? So that expands the lung this way. This thing that expands the thoracic cavity, right, gets bigger this way. So diaphragm expands the lung this way, vertically, and intercostal muscles in between the ribs expands the lung this way. Make sense? So inside the lung, the cavity gets bigger, right? Lung expands. So pressure goes down. Make sense? So when pressure inside the lung goes down, what happens? From outside, the air will get in. Is it clear? Always air moves from what? High pressure to low pressure, right? So when you expand the lung, pressure inside the lung goes down, air pressure. So automatically air will get in because outside the pressure becomes high. Now what is the amount of that pressure? That you need to know. Okay? Outside of the body, the pressure at sea level is 760 millimeter of mercury. This is atmospheric pressure.
Outside the lung.
Yeah. Outside of the body. Atmospheric pressure at sea level here is what? 760, right? Outside of my body. Here. That pressure is fixed, right? This is fixed pressure, not changing. Now let's see inside the lung. Inside the lung, now you tell me, when the lung expands, I said due to contraction of intercostal and diaphragm, right? The lung expands. The pressure goes up or down? Down, right? Now, when the lung recoils, it is highly elastic, right? So after that, lung recoils, gets smaller. So pressure inside will go up. Make sense? So inside the lung, the pressure is not fixed. You know that, right? When it expands, goes down. When it squeezes, gets up, right? So this pressure is called intrapleural. No, sorry. Intrapulmonary. Pulmonary means lung. Intrapulmonary pressure, which is not fixed. When lung expands, goes down. When it squeezes, contracts, goes up. So not fixed, ranges between 759 to 761 millimeter of mercury.
When you inhale, it goes up, and when you exhale, it goes down.
So now you tell me that lung pressure inside the lung is called what? Intrapulmonary pressure, right? Pulmonary means lung, inside the lung. Intra means inside. Now, when the lung expands, the pressure is lower, right?
Right.
So this is the pressure when lung expands. Is it clear? And when squeezes, recoils, the pressure goes up to 61. Is it clear? So that is the range. Now you tell me, when your lung expands, the pressure inside is 759. And outside is what? 760, right? So here is slightly lower, right? How much lower? Only 1 millimeter of mercury. And that pressure difference is strong enough. 1 millimeter of mercury pressure difference is strong enough to move the gas from here to here. Is it clear? That means from outside of my body to inside my lung. Is it clear? Now, after that, when the respiratory muscles relax, lung will recoil, will go back to its actual shape, right? Recoil, elasticity. So the pressure will start to go up and will go up to what? 61. So now inside is more than outside, right? How much more?
One.
Only one. And that is enough to expel the air out from the lung. Makes sense? That is expiration. So you see, only 1 millimeter of mercury pressure difference will move the gas, right? From outside to inside, inside to outside. Okay? And that is happening all the time, 24 hours. Okay? Your respiratory muscles are contracting, lung is expanding, negative pressure is being created, air is getting in. Negative means low pressure. Okay, so you got atmospheric pressure, intrapulmonary pressure. There is another pressure you need to know. You remember in between parietal and visceral layers, you have the pleural cavity, right? And in this pleural cavity, the pressure is called intrapleural. Intrapleural pressure. Okay? Here, in between parietal and visceral layers. In that cavity. And this pressure is also fixed, and it is 756 millimeter of mercury around the lung, inside the pleural cavity. Around what? The lung, right? Now, let's go back to interpulmonary. Interpulmonary is this, right? 759 to 761, right? And interpleural is always fixed, 756, right? So, always interpleural pressure is less than interpulmonary. Make sense? Even when the interpulmonary is 759, interpleural is lower than that because it is always 756, right? Now you tell me how much lower is from this one to this one?
3.
Only 3, right? And from this one to that one? 5, right? So, around the lung, the pressure difference is -3 to -5. Make sense? Pressure around the lung is always less. How much less? -3 to 5. Okay? So, that negative pressure inside the pleural cavity keeps the lung expanded, prevents the collapse of the lung. Prevents what? Collapse. Just think that if around the lung the pressure is higher than inside the lung, would the lung be able to expand?
No.
No, but your lung expands, right?
Right.
So, if the pressure is high always around the lung, lung will not be able to expand at all. So, that pressure always must be less than here. Okay? If high, that will be a problem, and that happens if someone steps, hits with knife, okay, stab you. Then what will happen? A hole will be created here, right? I mentioned in last class. So outside of the body, the pressure is what? Right? And interpulmonary is 4 millimeter of mercury pressure difference, right? Here, less. It's a lot to move the gas strongly in. So what will happen? From outside of the body, air will get in. If you make a hole here in the pleural, okay? And now the pressure around the lung will be what? High, right? So your lung will not be able to expand. Okay? So that is called pneumothorax. That happens, okay? That can happen. You will not be able to expand the lung. Here, now see those pressures I have explained. This is the interpleural pressure, 756 millimeter of mercury. Okay. So that is the mechanics of respiration. The pressure difference always moves what? The gas. Gas is moved due to pressure difference. And a small amount of pressure difference can move the gas. Surfactant. Surfactant is secreted by type 2 alveolar cells, right? Surfactant secreting cells. And that fluid is very important, as I have mentioned, lies inside the alveolar wall and keep the alveoli open. Prevents the collapse of the alveoli. Okay? And I have also mentioned infant respiratory distress syndrome, this one. Okay? Due to lack of or absence of surfactant secreting cells. Okay? So that can happen due to genetic disorder, right? Or
if it's genetic, will they die?
yeah.
Yeah.
If it is due to premature birth, right? Then it may grow, the cells may. So, in the last class, I mentioned few clinical conditions, right? I talked about apnea. Did I? Apnea. Okay. Apnea. Can I? Yeah. Dyspnea. TA. Tachypnea. Apnea is a very commonly heard term, right? Apnea, sleep apnea. We use that, we hear that a lot. So apnea is cessation of breathing or stoppage of breathing. So if breathing stops temporarily, not permanent. If it is permanent, then it is what? Death, right? So apnea is temporary cessation or stoppage of what? Breathing. Okay. Now, dyspnea is distressful breathing. Labored breathing. That means the person is spending more, energy to inhale the air. Distressful breathing. Dyspnea. Okay? Distressful breathing. Tachypnea is what? Fast breathing. Tachycardia is what? Fast heart rate, right? Cardia. So tachy means fast. So the rate of breathing is higher than normal. Is it clear? Tachypnea. Sleep apnea is more common, and that happens due to obstruction of the respiratory tract. That is the main reason. Or too much relaxation of your muscles around the neck. When you sleep, the muscles relax. All body muscles relax, right? So if the muscle in the back of the neck, behind that trachea, relaxes, the tube gets narrow because of relaxation of that muscle. Muscle tone goes down. Or if any fat or some obstacle is there, that can also cause sleep apnea. Okay? That is called obstructive sleep apnea. There is another type of sleep apnea that the passage is fine, but that is called central sleep apnea because of the respiratory center that is not sending signal to the respiratory muscles. Okay? So for a while, your brain is not sending signal to the muscle. So breathing will be stopped. Then again it will start. Okay? So that originates from the brain. That's why we say central apnea. Anyway, so sleep apnea. Pleuritis the inflammation of pleura, also called pleurisy, same thing. Itis is inflammation of pleura, the covering of the lung, right? If that happens, the person feels pain during breathing because the pleura is the covering of the lung, and if the pleura, those two layers get, inflammation, when they move, you feel pain because you are breathing, expanding the lung, contracting the lung, those two layers move like this, okay? So that will cause pain during breathing. Inflammation of pleura. Pneumonia. Have you heard this?
Yeah.
Okay. Pneumonia is the infection of the lung tissue, not the covering. Lung itself. Make sense? So lung tissue itself, not the covering. And when lung tissue gets infection, it secretes mucus a lot. Pus can be accumulated in the tissue. Fluid with mucus will accumulate. Sometimes we see pus, dead tissue. Okay? So the infection could be bacterial or viral, or sometimes pneumonia occurs without bacteria or virus. Chemicals can also cause inflammation. Okay? So pneumonia. Bronchitis. Bronchitis could be acute bronchitis and chronic bronchitis. Okay? Acute bronchitis is for short time. Okay? Acute means short. It will come and after a few days it will be recovered. But chronic, it can last from months to years. Okay? Some people suffer throughout their life, chronic bronchitis. Okay? So prolonged from 2 months to any time long.
That's inflammation of the bronchus?
Yes, that is itis of bronchus, right? So, bronchial tree, I have talked about, right? Tree. So, if in the tubes, the bronchial tube, inflammation occurs. So, this is the bronchial tube. Now, this is normal, okay? This is normal. Now, if inflammation occurs, the wall of the bronchiole will get what? Swollen. Thick, right? Inflammation. So the lumen will get narrow. Make sense? First thing. Now, if the wall gets thick, the lumen will get narrow. Also, the wall will secrete a lot of mucus, so that will also block the passages. Make sense? So, due to inflammation, the wall will get thick, so the lumen will get narrow, right? As well as secretion will occur there, mucus secretion, okay? So, the person will have problem in breathing, right? Distressful breathing, bronchitis. One main cause of bronchitis is smoking. Smoking is one main reason of bronchitis, but inflammation can occur by microorganisms, by excessive use, or chemicals. The term we use COPD, right? Chronic obstructive pulmonary disease. Chronic, if it is chronic, right? COPD, obstructive pulmonary disease. Now, obstruction can occur due to bronchitis, as we have seen, or other clinical conditions can also cause. So this is a broad term. Okay? Anything if causes blockage, that is obstructive pulmonary disease. Emphysema emphysema. You remember the alveoli, alveolar sac, alveolar duct. So these are alveoli here. These are alveoli. Now in emphysema, what happens? Many alveolar wall get destroyed like this. So you see here, the alveolar wall has been destroyed in many of these alveoli. So the surface, total surface area decreases. Exchange of gas will be significantly low. Make sense? Many alveolar wall is destroyed. So destruction of alveolar wall. We know that gas exchange occurs through the alveolar wall, right? So if you have less alveolar wall, then less gas exchange will